in the last 5 years, I've become a carer for my mum, who's got Alzheimer's. My kids are now teenagers. I am properly in this sandwich generation where there is this multiplicity of demands on my attention and time. And so actually, even though I feel like I've lived my life so that I'm well supported and I look after myself really well, there's still always something that's going to happen to upset that balance. So, yeah. So that's where I am now, juggling those care responsibilities with running a business and being a part of my community as well. Well, actually, how do you find, coming back to burnout, their lives are so busy and so full, but actually thinking about finding pockets of rest, and that rest could be that you go from one meeting to the next slowly. So if it's physical meeting rooms, I can remember working for one place where it was like, most of them were on the ground floor, but there were a couple that were up there. You just walk slowly rather than always rushing into places, so that you've got time to take a breath and just kind of settle yourself from one to the next. And a Zoom meeting, take 5 deep breaths between leaving one and entering the next one. So there's tiny, tiny pockets of time where you create a more restful experience can help kind of keep you coming out of that fight or flight, out of that really high adrenaline, busy momentum, into a slightly more settled state in your brain, which actually then is better for decision making, better for connection, better for holding your boundaries. Acknowledging that at the center of all of this are individual women with individual experiences, just as there are individual men with individual experiences. That if we've got a culture that acknowledges that and can be reasonably flexible and allows the boundaries to be established, then that's better. But it is fantastic that there is so much more conversation about women's health and about menopause. I always say, I can't remember if I said this to you in our conversation, about how when I first started talking about perimenopause and writing about perimenopause, say 10 years ago, it was always spell checks in a Word doc, or when I was writing a blog or a social media, there was always little red dots underneath the word perimenopause. But that doesn't happen anymore because there's so much more conversation about it. And I think that's got to be a positive thing, as long as it doesn't become demonized or count against you if you want to change jobs and someone's perimenopausal, we're going to have to give them X amount of leave. Just like women of childbearing age can find that that's a problem for them as well.
Whoever's responsible for the change either has their own agenda and are quite happy with the way things were and don't want it to change, or they're not involving the people who are actually directly going to be affected by it.
Yeah. Which
you've got to do. Like, it's back to cater to the individual, isn't it? And create that environment for each of them to succeed.
Yeah. But also to change things, because then the whole organisation needs to change underneath it. But if you've got people who've been there a really long time and are really entrenched in their ways of doing things, then they'll find a way of making it go back to how it was anyway.
They'll just ignore you, to be honest.
Yeah.
Unless you're doing that effective communication piece and involving them in the process as well, and making them feel a bit of ownership of the change.
Yeah. So an example of somebody I spoke to recently is really interesting. So I've gone into her organisation and they've got this menopause, they've got like a menopause network. So they have got like a support group, and they work on making the environment in the office more comfortable, on thinking about changing schedules if women are really struggling with their symptoms, on making sure that there are sanitary products in the bathroom, that there's, if someone's struggling with night sweats, maybe there's a spare t-shirt around that they could change into, or, really lovely. I've come in and given talks on managing different aspects of perimenopause, as well as on menstrual health and menstrual cycle tracking. So they're doing lovely stuff for all aspects of health in the workplace. I just come in on the women's health side. But when I had a conversation with her for doing some market research on a program that I'm developing, she's menopausal, and she cannot ask. So she asked if she could go from 40 hours a week to a 37-hour-a-week contract, and she was told no. And she doesn't want to give up or change her job. She feels like she's worked so hard to climb the structure. She feels like, and she doesn't want to let down the people who came before her who helped open the doors. So that's what's really interesting, isn't it? Like, so an organization can be ticking the boxes and can have leadership who want to support women's health, who are ticking boxes, but yet deep down ingrained in that culture is this sense that if you want to succeed, you can't you have to push yourself this hard. There's this much work to do and it's got to be done.